All right, my name is Steven. Today I'm looking at the research question, is consumption of saturated fats associated with depression symptoms? I believe this is a relevant topic because it is of the utmost importance for us to be aware of what we are eating on a regular basis. And saturated fats are commonly found in a lot of foods we eat, including meat, usually fatty cuts of meat, butter, cheese, sour cream, ice cream. A lot of those have saturated fats. And so what many people may not realize is that there are different unexpected effects that our diet can have on us that may not even be physical. And so mental health is one of those. And doing a quick search, uh, you find a blog post from Psychology Today when you do a quick research on saturated fats and depression syndrome or depression symptoms. And the blog post reviews an actual scholarly source, which is beneficial. But it would be best for us to go out of our way to review that source ourselves, because blogs and other non-scholarly sources may take bits and pieces of published work to make it fit the agenda or the agenda they want to push, or just to make a more intriguing article. So we want to make sure that the actual work that has been done, that we look at that as well. So the article that I researched was titled "The Associations of Dietary Patterns with Depressive and Anxiety Symptoms: A Prospective Study." And the intro just gives a quick little background that millions of people suffer from mental health disorders, with depression and anxiety being some of the most prominent uh, overall umbrella terms for that. And then previous studies had associated dietary trends with mental health, but there was limited evidence on which of those dietary patterns are associated with depression symptoms specifically. So for the methods, they took 126,000 participants to complete questionnaires with dietary data taken throughout the study. And they used these tests. One of them was the Patient Health Questionnaire 9, and the other the General Anxiety Disorder 7 test. And then the results found that there were about 2,700 cases of depressive symptoms and 2,200 cases of anxiety symptoms reported in that follow-up. And then after analyzing the diet patterns, they found that saturated fats was one of the most common factors associated with an increased risk of depressive symptoms. And then in the discussion, they talk about how dietary patterns, including high consumption of chocolate, butter, cheese, added sugars, milk, while having a general low intake of fruits and vegetables, was directly linked to anxiety and depressive symptoms. And so, as they conclude, they state that free sugars and saturated fats are directly correlated with risk of anxiety and depressive symptoms. So, looking at that article, we can take that and apply it to our daily lives. And so, to reiterate, it is important to look at empirical studies like this to expand our knowledge on health related topics, because it has real evidence to support their claim and allows us to expand our knowledge on the topic to understand more. So yeah, thank you so much.